At 8 minutes past 9, we're going to go across the world via the power of FaceTime. And the world has got a common enemy in the form of the virus. It does not discriminate between races, age, or gender, and across the world, people are fighting to overcome it. And this includes Abingdon based charity, the Nasio Trust. CEO Nancy Hunt is in Kenya as she hasn't yet been able to get home. She's busy coordinating their on the ground response to the virus. Good morning to you, Nancy. Thank you so much for being there. Hope you're well.
Yes, I'm well. Thank you very much.
Now, Nancy, for people who don't know, could you just briefly explain what the Nasio Trust does?
So the Nasio Trust supports vulnerable children communities in Kenya. We were set up to provide education, healthcare, and sustainable projects to help people get out of poverty. And so we've been doing that for nearly 20 years, based in our Bildon office.
Fantastic. But give us a picture now, though, Nancy, of the situation there in Kenya as far as the COVID-19 coronavirus is concerned.
So basically, when the virus broke out, it was a bit odd because most people, when they hear of a virus, it's in Africa, but this time it was out of Africa,
Mm.
and all they had was what was being said on news and television, and they didn't really get it until when the numbers started rising in Kenya. And at the moment, we have about just over 1,000 people who are positive. Of course, we've had a few deaths. And having said that, we just want to give our condolence to families and friends in UK who've lost family over the virus, and we cannot even start to compare what we've got here and what people have gone through in the UK and what the National Health Service has been doing. And so taking it very lightly to the first thing that really
Nancy, I'm just going to stop you
difficult.
there, my love. I'm so sorry. You were perfect in terms of reception. So if you've stepped somewhere near that lovely bird, could you go back slightly to where you were to begin with? Um, but I was getting the picture there, Nancy. That is it relatively early days in terms of sort of the picture of coronavirus in the country.
Well, it's what is interesting. The impact is different to what people in UK are going through. So in Kenya, most people live hand to mouth, and therefore there's a point with the travel restrictions, curfews in the evening. People are not allowed to go to markets. People are starting to say, "Hang on a minute, I have to go out to work." Or to the market to be able to feed my family, and they're saying, "Look, I'm sick and tired of this. I'd rather die of COVID than die of starving or my family dying from
Oh my
lack of
goodness.
food because
Mm.
there's no income. If you haven't earned it, you can't buy food for the day for your family.
Mm.
So the impact is felt in a completely different way. People are now not afraid of the virus, they're more afraid of lack of food.
And on top of this, Nancy, there's also been flooding to deal with in the country, I understand.
Yeah, so we've just had so much rain since the end of last year, and at the moment in Kenya, more than 7,000 have been affected by flood. Now, coming down to where we are, we're near Big River, and for the first time, they're saying since probably 1960s, they've never seen anything like that, and we have more than 400 people that have been displaced by the floods and now living in local primary schools that are terrible, terrible. I mean, I've visited more than 3 times in terrible conditions. And what has
Nancy, we were just getting a bit of a feel of the complex operation that is happening there. I mean, just talk us through again what you're doing to really help the people of Kenya on behalf of the Nasio Trust there at the moment.
so we very quickly realized that most of the World Health Organization campaigns against COVID were either on radio or television, and nobody had thought about people who don't have either. And so communities had never had COVID as a virus. So we mobilized 140 community health volunteers who work in the community, and then 700 young people because schools have been closed because of the virus. So we got them to do door to door. They did over 25,000 households, just telling people there is a virus. You need to wash your hands and you need to stay safe. Now, the biggest problem is with the living conditions, people crammed in grass thatched houses, you cannot social distance. So we realize there's nothing you can do about social distancing, but it's pushing. But what has been very fascinating, we thought, because we also run a medical center, we decided to test all waterborne diseases because we thought if people are washing their hands every single time because of COVID, something in regards to health must change. And we were shocked that all waterborne diseases like diarrhea had dropped, scabies had dropped, food poisoning had dropped, typhoid. So we've now realized that a lot of diseases that are in Africa that are caused by hygiene can actually be prevented if we just continue with the campaign. So our vision is now to continue encouraging people to wash their hands. So we're setting up something called a Tippy tap. So what a Tippy tap is basically you recycle plastic, you put a hole on it, and when you tip it with a pedal, it tips the water without you having to touch the container. So setting up those in everybody's homes to make sure they continue washing their hands and keeping clean.
Nancy, this sounds like a sort of breakthrough. If we can sort of help in all those diseases with this Tippy tap, that sounds absolutely like we're at the start of something. Nancy, sadly the signal is still not great. So my last question for the time being, but hopefully we can catch up with you in the future, is you are in Kenya at the moment doing very, very important work. Are you going to come back to Oxfordshire if you can at some point in the future, or are you going to stay where you're needed in Kenya?
I think what has really come to light is because I've been on the ground, we've really made an impact on mobilizing government, Ministry of Health, because we were the first charity, the first organization that actually started sensitizing. So we started setting up campaigns in town centers and demonstrating hand washing and encouraging businesses and people to take hand washing into their homes. So I believe that being here and just getting the team to focus on high level strategic community changes would probably be the best thing for the community, also for the charity. We've also been amazed. We've had amazing volunteers in the UK who've come up and helped us with fundraising, and there's two people who've been running a marathon every day from the 1st of May. We're just impressed by what they've been doing. So yes, the support in UK has been incredible, and I just think that the charity now has changed in terms of going forward. We're going to be more strategic in terms of community development, health improvement, and just helping people out of poverty. We're also starting to think past or post COVID. How are we going to make sure that these communities for now, with the floods, most people have lost their food because the farms have just been swept away. And unfortunately, with the rain, it also brought hippo, believe it or not. And so whatever was left from the flood has been eaten by the hippos. So we were saying, look, we need the Kenya Wildlife Service to come and contain these hippos because they're also very, very dangerous. So we're looking at how do we improve farms, farm goods, people's health, just getting people back to being restored as communities and recovering from the COVID virus. So on the 28th, which is next Thursday, we're doing a massive awareness in the town center, and we're more than 4,000 people with the Ministry of Health just answering questions about COVID, about health, about poverty, about unemployment, but most importantly, how people prevent themselves from unavoidable diseases.
Nancy, thank you so much for your time. Apologies for the slightly iffy connection, but it was such an important message to get out there about the work that is being done by Abingdon-based charity, the Nasio Trust.